While polio eradication partners and activists celebrated the successes of the global fight against polio on Monday, World Polio Day, they also asked for additional support needed to wipe out the disease for good. Since 1985, efforts by the Global Polio Eradication Initiative has brought the world the closest it has ever been to ending polio, with 21 wild polio cases so far in 2016. Meanwhile, the World Health Organization's strategic advisory group of experts say two companies making vaccines are failing to produce enough vaccines, so many countries should prepare to give lower doses to make stocks last. Polio is a contagious, crippling, and potentially fatal infectious disease that mainly affects children under 5. There is no cure, but it can be prevented through immunization. Joining us live via Skype from Atlanta, Georgia, is Dr. John Verfoy, Polio Eradication Branch Chief with the U.S. Centers for Disease Control and Prevention. Dr. Verfoy, welcome to the program.
Well, thank you, Leonard. It's a pleasure to be here.
First of all, World Polio Day was yesterday. What is the main takeaway from that commemoration?
I think the main takeaway from yesterday's celebration was just a sense of optimism and commitment. We've never been closer to eradicating polio. The opportunities to interrupt global transmission in the coming year are enormous, and there was just a sense of a continued commitment and push forward to finish this job that we started.
Now, polio vaccine is the solution so far to preventing the spread of polio. And the panel of experts, WHO's experts, recommend that the dosage be lowered. What is the take? What does this mean for the global fight?
Thanks for asking that. So there are actually two main types of vaccines that are used to fight polio. The first is oral polio vaccine, which contains weakened live virus, and that's the primary way that we move to interrupt polio globally. As part of the end game for polio eradication, though, we want to remove that live vaccine and make sure that every country has introduced inactivated polio vaccine, or IPV. And so the reference from SAGE was related to, as we've ramped up the distribution of IPV, now about 80% of the world's population or birth cohort is covered by that vaccine each year. However, the production delays have resulted in slower supplies than we would like, or lower supplies than we would like in that regard. And so what they're recommending is actually that countries consider the use of fractional doses of that IPV as the production continues to expand. Science has shown that if you use 2 fractional doses, you can actually get better immunity than if you use a single dose of intramuscular IPV in a child.
Okay, and quickly, let's talk about Africa. We saw that what happened with Nigeria. A couple of cases were found, 3 cases exactly a couple of months ago. What does this mean? Where do we stand in terms of Africa getting rid of polio?
Yeah, there's no doubt that the identification of cases in Borno State of northeast Nigeria was a setback. But I think that setback really needs to be taken in the context of the larger achievements of that national program to reduce the amount of polio that it has, and also in the context of the rest of the continent and the globe. You know, in 2012, Nigeria had more than 50% of the polio virus in the world, and it, through a very consistent and concerted effort, reduced that and limited it to this one state that, as you know, has had a problem with the Boko Haram insurgency that has really restricted access to individuals. So I think that now that we're seeing, as the humanitarian crisis unfolds and as access has increased in recent months, we're seeing that these previously isolated populations are beginning to mix, and we picked up these cases. And so there's a very large global effort from all the partners and from the government, led by the government of Nigeria, as well as the surrounding countries in that region, to really vaccinate many individuals very quickly.
Dr. Verfoy, we have to leave it there. Thank you so much for joining us from the CDC headquarters.
Thank you so much.
And that was Dr. John Verfoy. He's Polio Eradication Branch Chief with the U.S. Centers for Disease Control and Prevention.